morning, Mrs. Smith. My name's Brandy. I'm going to be your nurse with you today. I'm going to start by doing a full head-to-toe assessment. Let me wash my hands and I'll be right back to do this. Alright, I'm going to pull the curtain so I have some privacy. Can you tell me your name? Mrs. Jane Smith, alrighty, and your birthday. 1/18/85, alright. Well, I read in your chart that you have a history of kidney stones and that you're currently having pain in your back, also difficulty urinating, which is all expected with a kidney stone. I already looked over your chart and got your vital signs. The nurse assistant took your blood pressure in both arms and it was about equal, 130/78. Your pulse is at 97 and she took your temperature orally and it was 98.1, so there's no signs of fever or infection yet. I noticed that your body alignment is maintained, it's straight. You're well dressed and well groomed. Alright, you eat enough throughout the day, except if the pain's bad, it's hard to eat because it's difficult. I know that you're here in the hospital for the pain and that tomorrow's Thanksgiving. Alright, I'm going to start by looking at your head. I notice that you have a full set of hair. I'm going to look all down your body. I don't see any hair anywhere else, so you don't have any abnormal hair growth. I'm actually going to sit your bed up a little bit. Sorry about that. You don't have any red spots in your scalp, no itching or anything. Alright, next I'm going to look over your skin condition. Your skin color is, when I touch your skin everywhere, it's nice and dry and warm. I don't notice any lesions or ulcers or anything abnormal. Do you have any itching of the skin? No? Alright, your skin's all intact. You don't have any sores or rashes. Alright, next I'm going to look down your fingers at your hands. I'm going to do look at your nails, and your capillary refill is less than 3. You have no clubbed fingernails, so no signs of lack of oxygen. You don't smoke, which is good. Alright, I'm going to continue palpating down. I didn't notice any edema in either of your ankles or your feet. Alright, I'm going to continue with my assessment. Next I'm going to look at your eyes. I don't notice any discharge or redness. I would take my pen light and I shine it in the patient's eye both times. I would notice that the pupils were equal, reactive to light, round and accommodating. You deny wearing glasses or contacts, and you say you aren't colorblind. Your conjunctiva is nice and clear and white, and you don't have any problems with your eyes. Next I'm going to look at your ears. I don't see any hearing aids, and you can hear me just fine as I talk to you. Your ears are aligned on both sides of your head. There's no discharge, and you don't have any recent hearing problems or tinnitus, such as ringing in the ears or anything. Next, what I would have the patient do is lean over the side of the bed to where their back is facing to me. I would have them put one hand over one ear, and I would whisper something to them to see if they could hear me and have them repeat it. And then I would do that with the other hand. Have them hold their other hand over one ear, whisper something to them, and see if they can hear me, and have them repeat it. While I have her over the side of the bed, I would look at her back, at her spine to see if there's any curvature or any abnormal things going on with her spine, but hers is most likely well maintained, or well aligned, I should say. Next I would look at her nose. I noticed that both of her sides of her nose are equal. She denies any congestion, any bloody nose. She's able to breathe okay. I would have her put one finger over one side of her nose and breathe in, and then have her put her finger over her other nose and have her breathe in. Everything sounds nice and clear, all patent. Then I would percuss her sinuses on her head. When I do this, I'm going to ask if she has any pain whatsoever. If she denies any pain, then that's good, but if she says she has pain, then that might be a sign of drainage into that sinus area. Next, I'm going to look at her mouth. I will have her stick her tongue out and see if it veers off to one way or the other, because that could be a sign of a history of a stroke. If it does not, if it comes straight out, that's good. I will notice that it's moist and it's pink and there's no type of coating or film on it. This patient has a history of tonsillectomy, so I'm not able to grade her tonsils, but if I would, it would be on a scale of 0 to 4. Next, I would look at her teeth. I would ask her if she has any dentures, any bridges, any teeth that come out, any loose teeth, caps, crowns, anything of the sort, and if she did, why. But I noticed that this patient's teeth are white and straight and look well taken care of. While looking at the patient's teeth, I would also take note of her gums. Notice that they are nice and pink and moist. There's no inflammation, no problems with her gums. If she had bad breath, halitosis, I would take note of that. Next, I'm going to look at her neck. I'm going to have her move her head from side to side all around to test its range of motion. I would see that both sides of her neck are symmetrical. There's no swelling, no problems with her lymph nodes, no pain. If I palpate, I would look to see that her trachea is midline. I would then have the patient sit up a little bit and see if she has any JVD, jugular vein distension, when she sits up, because that could be a sign of circulation issues. Next, I'm going to look at her neuromuscular and test her strength. I would put my hands on the patient's shoulders and have her shrug against me. I would test to see that both sides come up equally with no problems. Next, I would have her squeeze both my hands at the exact same time to test her strength equally on both sides, because lack of strength on one side could be a sign of a stroke, which this patient doesn't have any history of strokes, but we still want to test everything equally. I would then have the patient get up and walk. She would do the heel-to-toe test to see how her balance is, and I would also do the Romberg test, and that is where she stands perfectly still, and I would come up behind her and just kind of give her a little tap, a little push, and then have her make sure she can stay in the same place after I push her from side to side and front to back to test her ability to stand. I could also do the finger-to-nose test, where she puts each finger on her nose at different times. I would make sure while she's walking that her gait is steady. She doesn't use cane, crutches. She doesn't need any type of assistance, which she shouldn't. She's young and only has the back pain. I would then do the deep tendon reflexes in her knees, and that's where you take the instrument and hit her right below the kneecap to make sure that her reflexes in her knees are equal. I would do the range of motion in her wrists and in her shoulders to make that she's able to move everything freely. When she sits up, I would notice that her head and neck are erect. It's not flaccid. Nothing droops down when she falls. While doing all this, I would also, mentally note her joints aren't swollen. She doesn't have any crepitus or contractures. Again, she's a younger patient, so that shouldn't be of concern at the moment.